There's time for Q&A with Dr. Christ and other speakers. Please use the talkback mic if you have questions. After we're finished, we will open the site with Dr. Baker and Dr. Christ vaccinating people over here. Grab your cameras, it'll be all access. Get registered here, vaccinated here, observation someplace. Anyway, so we'll turn it over to Dr. Christ.
Good morning, everyone. I'm Dr. Kara Christ. I'm the director of the Arizona Department of Health Services. And thank you for joining us as we celebrate this important transition from the state's Glendale vaccination site. Since opening over 100 days ago, the State Farm Stadium site has administered more than 800,000 doses of COVID-19 vaccine. It has won attention from other states, from federal officials, and from the president and vice president for its efficiency. This morning, we administered the last doses in the stadium parking lot and closed that facility. But Glendale's story is far from over. We've relocated to Gila River Arena, and along with our partners, are launching this air-conditioned walk-through site. I thank the Arizona Cardinals for being such terrific partners, and today I thank Gila River Arena and ASM Global, which manages the stadium and the arena, for advancing us this very successful operation. And I'm grateful to ASM Global General Manager Dale Adams for joining us, so thank you. I'm also grateful to Dr. Edmund Baker Jr., who is with us. He's the medical director for Equality Health, and he's helping us launch the Gila River Arena site in the most fitting way possible with vaccinations. Whether it's state-run vaccination sites or pop-up clinics, like Equality Health helps run in underserved areas, we share the goal of getting vaccine into the community rapidly and efficiently. And one of the pros of this site is you may get to watch the coyotes practice when you are in your observation. So we want everyone to have the chance to be protected against COVID-19, especially the communities that have suffered disproportionate numbers of serious cases and deaths. Maria Cristina Fuentes, Director of the Governor's Office of Youth, Faith, and Family, joins us once again to provide an update in Spanish. Her outreach to the faith community and Spanish-speaking community has been invaluable as we spread the word about COVID-19 vaccines. We have a common message. COVID-19 vaccines are safe. COVID-19 vaccines are effective. COVID-19 vaccines are free. And COVID-19 vaccines are available to everyone age 16 and older. In the few months since we launched a mass vaccination site in Glendale, we've seen a shift in our appointments. Vaccine appointments used to be snapped up almost as soon as they were made available. And now it's to a point where it's possible to get a same-day appointment at virtually any state site. Vaccine is increasingly available at pharmacies and federally qualified health centers. And Equality Health and others are taking vaccine further into communities. COVID-19 vaccines truly are the light at the end of the tunnel and the path to resuming normal lives. But we aren't there yet, and it's up to all of us in Arizona to get the rest of the way to herd immunity needed to check COVID-19. In many ways, the hard work has just begun. Today, a third of eligible Arizonans have been fully vaccinated against COVID-19. Nearly 5 million doses of COVID-19 vaccine have been administered in our state. Despite that great news, 2/3 of eligible Arizonans have yet to be fully vaccinated. I'm confident that together with our county partners and leaders such as Dr. Baker, we can continue the strong momentum from these first few months of vaccinations. And now I'm going to turn it over to Dr. Baker. Dr. Baker?
Thank you. Good afternoon. I'm Dr. Edmund Baker, the Medical Director of Equality Health. 13 months ago, I was asked by Allison Rodriguez of ABC to man a phone bank where my team from Equality Health answered questions about the novel coronavirus. I remember hearing the concern in the voices of the callers And at that time, we didn't have treatment options or a vaccine. It was only a dream. Fast forward to today, and the virus that causes COVID-19 has taken more than 570,000 lives in the United States, including 1,238 Arizonans. We now know the people of color are more than twice as likely to die if affected by the virus. While I am a physician, I am also a veteran, a husband, a father, and an active community member. I have seen firsthand the devastating nature of this virus. And like you, my family and loved ones have been directly impacted. In Arizona, 33.8% of white Arizonans have received at least one dose of the vaccine. In contrast, only 18.6% of Black Arizonans and 14.5% of Latino Arizonans have received at least one dose. But we must achieve community-wide immunity together to protect our most vulnerable populations. For generations, people of color has passed along important information through our stories. We share our stories through the spoken word to communicate critical information about our community and our families. That is how we overcome hesitancy and apprehension, by sharing the good news about the vaccine and what it has allowed our families to do, to gather for Sunday dinner, to see our grandparents, and to celebrate our loved ones' birthdays. I'm calling on you to tell your story of vaccination to every place of worship, every barber and beauty shop, every community organization, and to all your family and friends to help disseminate trusted information and to continue the conversations about the importance of vaccination. Together, we can defeat COVID-19 as one community. And remember, protect yourselves and protect your loved ones. I now pass the podium to Mr. Dale Adams from Gila River Arena.
Good morning and thank you. Wow, this is such a great opportunity. I think I'm very grateful for everyone to be able to let us host such a important event, if you want to call it. That's what we do, events. This industry, and again, I manage the Gila River Arena, and this is what I call the entertainment capital of Arizona. And no industry has been hit harder than this industry. Let's face it, we deal in mass gatherings, and that has kind of been a bit of a problem for us here. So we've been working through it all this year, and to be able to be part of such a great event, get people vaccinated and get our events back and get people into the arenas and the stadiums again. We're so excited about this, and it's such a great opportunity for us to be a part of it. We look forward to kind of getting everybody in here, and I know myself and my staff, most everyone has been vaccinated, and we're hoping to get everyone in here and get them vaccinated also. Just a really great opportunity for us to reach out to the public and get all our fans in here and get our people back to work too. So dual fold, it's probably one of the best things that we ever done, one of the best events we'll ever have. I'm really happy to see everyone in here, and we're very excited about this. Thank you.
Hola, muy buenos días. Mi nombre es María Cristina Fuentes y soy la directora de la Oficina del Gobernador para Juventud, Fe y Familia. Gracias a todos por acompañarnos hoy mientras celebramos esta importante transición para el centro de vacunación de Glendale. Desde enero, el centro de State Farm ha administrado más de 800,000 dosis de vacuna del COVID-19 y ha recibido la atención de otros estados, de funcionarios federales, el presidente y la vicepresidente por su eficiencia. Esta mañana hemos administrado las últimas dosis en el estadio y hemos cerrado esa instalación. pero la historia de Glendale continúa. Nos hemos trasladado al Gila River Arena. Junto con nuestros socios en este esfuerzo, estamos lanzando este centro que va a ser walk-through y con aire acondicionado. Estamos muy agradecidos por el apoyo excepcional que nos han dado los Arizona Cardinals y hoy estamos muy agradecidos por el apoyo que nos está dando Gila River Arena. Gracias a ellos hemos podido establecer esta exitosa operación. Queremos que todo el mundo, que todos tengan la oportunidad de estar protegidos contra el COVID-19, especialmente las comunidades que han sufrido un número desproporcionado de casos graves y muertes. También tenemos un mensaje común. Las vacunas del COVID-19 son seguras. Las vacunas del COVID-19 son eficaces y las vacunas del COVID-19 son gratuitas. Las vacunas están disponibles para todos en Arizona que tengan 16 años de edad o más. En pocos meses transcurridos, desde que pusimos en marcha un centro de vacunación masiva en Glendale, hemos visto un cambio en términos de las citas de vacuna. Al principio, las citas se llenaban casi tan pronto como las hacíamos disponibles. Hoy por hoy, hemos llegado a un punto de que es posible obtener una vacuna el mismo día, prácticamente en cualquier centro estatal. La vacuna está cada vez más y más disponible en farmacias y en centros de salud clasificados por el gobierno federal. Y Equality Health y otros están llevando las vacunas más y más lejos dentro de nuestras comunidades. Estas vacunas son realmente la luz al final del túnel y el camino para reanudar la vida normal. Pero aún no hemos llegado a ese punto y depende de todos nosotros individualmente ayudar a que Arizona llegue a un punto de inmunidad necesaria para controlar el COVID-19. En muchos sentidos, el trabajo duro acaba de empezar. Hoy, 1/3 de los arizonenses elegibles han sido completamente vacunados. Se han administrado más de 5 millones de dosis de vacuna contra el COVID-19. A pesar de esta gran noticia, todavía hay 2/3 que no han sido vacunados. Por favor, hagan su cita hoy y vacúnense contra el COVID-19.
And so thank you guys for joining us this afternoon. This is likely our last big mass vaccination site opening or kickoff that we'll be doing. But we're happy to take any questions.
I've got a question for Dr. Baker, if possible.
Yes, Dr. Baker.
Hi, Dr. Baker. Cameron from ABC 15.
Hi.
I wanted to speak to you. What do you see as the biggest obstacles to vaccinating communities of color and minority communities in our state?
Very good question. So I believe the true barriers are just education. We have now gone into the community, so we're accessible. The vaccine is there. The state has done a great job of getting us the vaccine. We just now have to educate everyone so that they understand what this vaccine is, how safe it is, and how important it is to save lives.
How important are anecdotal stories from trusted sources when it comes to that?
Well, just talking personally, being from the Black community, that's how we did everything. Everything is talked. We talk over the dinner table, and that dinner table goes to the church, and the church from the pulpit goes out to everyone else, and it just spreads. So trusted words come from people you love first, then to the organizations you love, and then out to the masses.
Thanks, Dr. Baker.
Yes, thank you.
I'll go. I'm right here. Thanks for your time. Want to just ask, you mentioned that it's possible now to probably get a same-day appointment at most of the state sites. Obviously, that's changed quite a bit than what we first saw in January, February, even in March. Why do you think, people aren't booking appointments now?
So we think that there's a couple of reasons. One is that the supply of vaccine is starting to meet the demand. So initially we didn't have a lot of vaccine and we only had limited appointments that we could open up because we wanted to make sure that everyone who had a vaccine or had an appointment would get a vaccine and we wouldn't run out. Now we're able to open up a lot more appointments. But you're able to find the vaccine many other places now. So if it's easier to go to the pharmacy at the corner to get your vaccine, they have vaccine at our retail pharmacies, at community health centers. There's a lot more pop-up events that are going on. So people are able to get them closer to home and in the community, which is really what we want. However, we do know that we are still doing tens of thousands of shots a day and a week at these mass vaccination sites. So we know that there's still good points of access for vaccine as well.
I think it was maybe last week or the week before, you had mentioned that you guys had leftover appointments, and anecdotally you had heard that your pharmacy partners also had leftover appointments. So while it is available, are people just not taking it?
So what we've probably reached is that low-hanging fruit of Arizonans that were like, no matter what, I am getting this vaccine, even if it's at 2:00 in the morning at State Farm Stadium. I'm going to stay up. I'm going to, do that. Now we're probably reaching Arizonans that, want to get the vaccine, but are very, very busy. So now we're going to try and reduce some of those barriers, make it easier, get more sites in the community, let them know about pharmacies, and really start to now encourage walk-ins at some of our sites and those types of things. So people don't need to plan to get their vaccine, but it's more convenient.
So I just want to make sure, you said that you're encouraging walk-ins now possibly in the future?
So one of the things that they were doing yesterday at the Westworld site was encouraging walk-ins. They were allowing walk-ins to go. For all of our state-run sites, it doesn't work just yet, but we're working on potential opportunities for walk-ins.
And then Dr. Baker, I have a couple follow-up questions for you as well. I guess, when people, in these community vaccine sites, sorry, can you hear me? Am I talking loud enough? Okay. As people, have come through the community vaccination sites that you've done, what has maybe drawn them there at that point? And have they talked to you about what kept them away, or maybe what took them a while to get there?
So I do a lot of community talks, and I speak to a lot of organizations and a lot of people within the community. And I hear all their concerns. A lot of them come from Facebook. Some people are concerned because of the historical problems we've had in our community. And that's something that we can easily talk through. And then there's some of the conspiracies you see on Facebook. I believe those truly are easy to talk through as well. I just have to continually educate so that they understand this vaccine, even though it seemed to come quick to us, the research behind it is years in training, right? The mRNA just didn't happen yesterday. We've been studying that for almost 10 years. So what we do now is no different than any other industry that comes up with something at a quicker pace, because now we have technology. So once they start to understand those things, they start to feel a little bit more confident, and a lot of people start to ask to be vaccinated.
As you kind of look at, where we go from here, do you think that those community sites then those community clinics are going to be what's the most important as we go forward to try and get people vaccinated?
So it's multifaceted, right? The community clinics is only one part of it. Those people that come to those clinics have good relationships with us. But it's people who don't come to our clinics that we have to go after too. It's those that are homebound, right? We have to find a way to make sure we get to them, as well as finding ways to get to people who aren't connected. So these events like the one tomorrow at South Mountain Community College and like the other ones you'll see pop up around the city, we try to find a way to be close to everyone so that they have access.
Thank you.
Yes, ma'am.
Good afternoon, Dr. Christ. So I just came from an event that Unidos US is doing at the Phoenix, swap meet, and just kind of educating Spanish-speaking communities about the importance of getting vaccinated. I know that the department has done public service announcements, outreach in specific zip codes, but to Dr. Baker's point about education, now that the state-run sites are transitioning indoors, more walk-ins are available, can you talk about more education outreach that the state is planning on doing, specifically so that these populations who are lagging, as far as their vaccination rate, can be vaccinated?
Yeah, so that's a great question. So how are we communicating and getting to some of those groups, now that we're transitioning indoors, about the importance and safety about vaccination? So just like Dr. Baker talked about, Our community listening sessions identified that there were two groups of people that people really trusted. One was healthcare providers, but other ones were a trusted person who had already received the vaccine. So what we're doing is we're working with community leaders like Equality Health and Chicanos por la Causa to get personal stories of leaders and people in those communities, and then working on our social media to get those stories out so that people can see their pastors, their beloved doctors, their people in the community who are telling their story about getting vaccinated. But then we're also working on increasing the campaign. So we've got a toolkit for providers so that they can answer any questions that their patients might have. We're looking at developing toolkits for promotoras and community health workers because we know that they are trusted in their community. So there's a lot of work going on to try and get trusted people to have the information so that they can provide accurate information and get people to get vaccinated.
Perfect. Thanks so much. And I had a couple schools-related questions, if you don't mind indulging me. I know, several school districts having to make decisions this week about whether or not to keep or rescind their mask mandates. Can you just kind of reaffirm what your guidance is for districts that are kind of navigating through these situations?
Absolutely. So while the mask mandate has been lifted, the recommendation for masks has not changed. ADHS is consistent with the Centers for Disease Control and Prevention that it is an important prevention tool for schools. So kids should or everyone on a site at a school should wear a mask while they are there. And then also use some of those other prevention, the frequent hand washing and hand sanitizing, the physical distancing, but we still feel masks are an important component to a COVID-19 mitigation strategy.
Perfect. And so, would you have any messaging to districts who are making the decision to not require masks
I'm sorry.
at this time? Would you have any messaging to the districts who are making the decision to not require masks in the school at this time?
Yeah, so what we would recommend is, we, in the emergency measure that we issued, we recommend that they follow the CDC mitigation strategies, of which they cite universal and correct mask use while at school. And so our recommendation is to follow the CDC guidelines.
Perfect. And, according to the most recent data from the American Association of Pediatrics, Arizona was one of 12 states with more than 100,000 confirmed cases of COVID-19 among children. It was also one of only 9 states that reported more than 7,000 cases of COVID among children per 100,000 among the population. Can you talk a little bit about how those numbers and coupled with the fact that children under the age of 16 still aren't able to be vaccinated kind of play into both your guidance and these decision-making processes for schools?
Yeah, absolutely. So children they're not eligible yet to get vaccinated. We do know that Pfizer has submitted their data to the FDA to get that approved for age 12 and above. So we're very excited to when that becomes approved through the EUA for them to be able to administer, which is why we recommend that the CDC prevention guidelines be implemented in schools. We've done a really good job of getting a lot of testing. Here in Arizona, you can go almost anywhere and find free COVID-19 testing. And so we have been encouraging students and teachers and people in the community to get tested. What we've seen here in Arizona is it's not so much transmission in the classroom that's the primary mechanism. It's the after school and extracurricular activities as well as family gatherings or parties outside of school. So what we would recommend, school really is for our children one of the best and safest places to be. We recommend that they wear a mask, that they wash their hands often. My kids wear a mask when they're at school, and they will continue to do that. But we don't see a lot of transmission inside the classroom, and that's because our school districts have done such a great job in implementing those COVID-19 strategies.
Absolutely. And is there a concern that could change now that some districts are no longer requiring masks?
So, a lot of it could, depending on that. However, we have had schools that were not under the emergency measure order, that stayed open the whole time and haven't used masks. And we haven't seen large outbreaks associated with those schools. As long as they're keeping them physically distanced, our recommendation would be the universal and correct use of masks inside. And we would like to see all schools implementing that. But we knew that there were some schools that were not.
Perfect. Thank you, Dr. Chris.
You're welcome. All right. Where'd Steve go? Oh, there he is. Okay.
Thank you, Dr. Christ, Dr. Baker, and everyone. So the next part of the program is vaccinations. So that will occur right over here. It's all access. Everyone is consented. So, keep the peace and do your jobs.